Ovarian cancer is relatively rare in teenagers and young adults compared to older women, but it can occur and has unique considerations in this age group. Here's an overview of ovarian cancer in teenagers and young adults, focusing on its characteristics, symptoms, diagnosis, treatment, and prognosis. Overview: ovarian cancer typically occurs in women over 50, but in teenagers and young adults, it often presents as a different subtype and may be associated with specific genetic predispositions. The most common type found in younger women is germ cell tumors, which arise from the cells that produce eggs. Types of ovarian cancer in young women: germ cell tumors. These are more common in adolescents and young adults and can include subtypes like dysgerminoma, the most common malignant germ cell tumor in this age group. Yolk sac tumor, known for rapid growth and aggressiveness. Teratoma, can be benign or malignant. Mature teratomas are often benign. Epithelial ovarian cancer. Though less common, young women can also develop this type, which includes serous and endometrioid tumors. Sex cord stromal tumors. These tumors arise from the supportive tissue of the ovary and can include granulosa cell tumors. Risk factors. While the risk factors for ovarian cancer in teenagers and young adults are not as well defined, some considerations include genetic mutations. Inherited mutations in genes such as BRCA1 and BRCA2 can significantly increase the risk of ovarian cancer and breast cancer. Young women with a family history of these cancers should discuss genetic testing and screening with their healthcare provider. History of other cancers. Young women who have had previous cancers, such as breast cancer or endometriosis, may have a higher risk. Reproductive history. Factors such as early onset of menstruation or late onset of menopause have been discussed, but research is ongoing. Symptoms. The symptoms of ovarian cancer in teenagers and young adults can be nonspecific and may be mistaken for other conditions. Common symptoms include abdominal pain or discomfort, persistent or intermittent pain in the lower abdomen, bloating or swelling, increased abdominal girth or fullness, changes in urination, increased frequency or urgency to urinate, changes in bowel habits, changes such as constipation or diarrhea, fatigue, unexplained tiredness that doesn't improve with rest, unexplained weight loss, significant weight loss without changes in diet or activity level, menstrual changes, irregularities in the menstrual cycle or abnormal bleeding. Diagnosis. Diagnosis of ovarian cancer in young women involves several steps. Medical history and physical examination. Healthcare provider will assess symptoms and perform a pelvic exam. Imaging tests. Ultrasound, the first-line imaging test to evaluate ovarian masses. CT scan or MRI, provides detailed imaging to assess the extent of the disease. Blood tests. Tumor markers. Tests such as the CA-125 blood test may be used, but they are less reliable in younger women and often elevated in benign conditions. Biopsy. The definitive diagnosis is typically made through the surgical biopsy, where a tissue sample is examined for cancer cells. Laparoscopy. The minimally invasive procedure may be performed to visualize the ovaries and obtain tissue samples. Treatment. Treatment options for ovarian cancer in teenagers and young adults may include surgery. Debulking surgery. The primary treatment involves the surgical removal of one or both ovaries, the uterus, and any surrounding tissue affected by cancer. Fertility preservation. Young women may have the option of preserving fertility, particularly if only one ovary is affected. Chemotherapy, often administered after surgery to kill any remaining cancer cells. Common regimens may include combinations of carboplatin and paclitaxel. Radiation therapy, rarely used as the primary treatment for ovarian cancer but may be considered in specific cases, particularly for palliative care. Targeted therapy. Ongoing research is exploring targeted therapies that may be effective in specific cases, especially for patients with certain genetic mutations. Prognosis. The prognosis for ovarian cancer in teenagers and young adults depends on several factors. Stage at diagnosis. Early stage diagnosis generally has a better prognosis than late stage cancer. Response to treatment. The effectiveness of initial treatment plays a crucial role in long-term outcomes. Tumor type. Germ cell tumors tend to have a better prognosis compared to epithelial ovarian cancers, with higher cure rates in younger patients. Follow-up care. Follow-up care is crucial for monitoring potential recurrence and managing long-term side effects of treatment. This may include regular physical examinations, monitoring overall health and any new symptoms, imaging studies, as needed to check for recurrence. Psychosocial support, addressing emotional and psychological needs, especially considering the impact of cancer on young individuals' lives. Conclusion. While ovarian cancer is rare in teenagers and young adults, it can occur and requires careful consideration and management. Awareness of symptoms, risk factors, and the importance of early diagnosis can significantly affect outcomes. Young women diagnosed with ovarian cancer should work closely with their healthcare team to determine the best treatment options, including considerations for fertility preservation. Ongoing research and clinical trials continue to enhance understanding and treatment of ovarian cancer in this age group.